Hi, I'm Dr. David Green, CEO of the Arizona Pain Network, where we bring you anything and everything education for pain management. Today the topic is how to treat adult scoliosis non-operatively. When you become an adult and you have scoliosis, it comes from one of two ways, okay? The first is if you had scoliosis as an adolescent and it did not end up needing surgery, if you ended up becoming, quote, skeletally mature, meaning an adult, with a curve over 40 degrees, studies show it can get worse at the rate of 1 to 2 degrees per year. Doesn't sound like much, does it? But if you're 20 and 1 to 2 degrees per year all the way to 60, that can be a 40-degree baseline plus 40 more degrees. You can end up with a large curve, okay? And it can be painful. The other thing that can happen is, let's say you didn't have scoliosis at all as an adolescent. Well, as you get older, this is looking at the spine from the front, these areas, the discs, can start to degenerate in your 20s, 30s, 40s, 50s, and then you can start getting arthritis in these joints in the back of the spine called the facet joints. Now, none of this degeneration and arthritis occurs symmetrically, so if it occurs more on one side than the other, you can start to develop, a curve, okay? So what to do about it? Well, surgery for adult scoliosis can be very effective, okay? It can stop the curvature, correct it, take care of a lot of the painful issues that you have, but it is not without its risks. The risks of those procedures are over 65%, and the rehabilitation from those procedures can take 6 to 12 months. So it truly should be looked at as a last resort for patients, and the non-operative treatments that I'm about to explain should be looked at initially. First and foremost, anti-inflammatories and Tylenol. Those can be your best friend. Make sure to take them according to the manufacturer's recommended dosing, okay? Other than that, because you can get liver problems, kidney problems, GI problems, so just be careful and cognizant of that, okay? Especially if you're taking them at the higher dose ranges, 400 to 800 milligrams 3 times a day. Just, be careful, okay? For periods when the pain is bad, then short-term narcotics, opiates, can be very helpful. It's not a great idea to be on those long-term chronically, okay, because they can cause constipation, tolerance, addiction. But for the time periods when it's bad, and you're having a rough stretch, then those can be very beneficial, okay? So adult scoliosis can also lead to bouts of muscle spasms, all right? So that can be an indication for short-term, muscle relaxers. And, I mentioned short-term for narcotics, short-term for muscle relaxers. These types of things have side effects and complications, so it's best to do those in short-term when pain is bad, all right? Physical therapy can be extremely helpful. Now, bracing does not help for adult scoliosis. It's not flexible like it often is as an adolescent. But physical therapy can strengthen up the muscles around the spine and help take some pressure off of it, okay? So you have physical therapy, you have medication management types of things that you can do. A TENS unit can also be helpful. It's a simple device, looks like the size of an iPhone, goes on your waist, on your belt, and it has little foam pads that go over the area of where the most pain is. All right. Chiropractic treatment can help as well. Doesn't provide anything permanent, but it can give some temporary pain relief. Now, people with spinal stenosis, people with adult scoliosis often have spinal stenosis. Okay, so not only do they have back pain and aching and fatigue, they also may have some leg pain. So when you start talking about interventional treatments for adult scoliosis, you may have an indication for injections in or around these arthritic joints called facet joints, okay? And you can have a lot of them involved in the scoliosis and pain. So treating those, up and down on various treatment sessions can be very helpful. Now, if these nerve roots are getting pinched from the curvature and the arthritis, that's spinal stenosis. So that treatment for that is epidural steroid injections. And that can give weeks to months of pain relief, and those can be repeated. Okay? So you can have the facet injections, epidural steroid injections. If these injections in or around the facet joints work and then wear off, you can actually get a treatment called a radiofrequency ablation, which burns this area, and that can provide 12 to 18 months of pain relief. Very impressive. Okay? So it's not always necessary that the eventual outcome is going to be surgery for adult scoliosis. It may be that with a combination of the medications, the injections in or around these joints, epidural injections, radiofrequency ablation, the physical therapy, it may be that you're able to achieve a baseline pain level that is very tolerable, and then you wouldn't be subjected to the risks of surgery. Okay? There you have it. I'm Dr. David Green, CEO of the Arizona Pain Network. Visit us at preferredpaincenter.com. There's a slew of information on pain conditions and treatments. Arizona Pain takes over 50 insurances. They have 4 locations around the valley, and they offer board-certified pain management treatments, everything I just mentioned, okay, and more. There's also stem cell injection treatments that may be very helpful for the arthritis that you have in your facet joints. There's studies going on now. Call today at 602-507-6550. I'm Dr. David Green with the Arizona Pain Network. Your pain stops here.